Okay, I will be starting off by introducing our organization, Childhope Philippines. We are a registered, licensed, and accredited social welfare agency by the Department of Social Welfare and Development, or the DSWD. We work to promote and protect the rights and welfare of children in street situations, or the CISS, or what we commonly call the street children. Childhope does not run an educational institution nor an orphanage. Instead, we provide integrated direct programs in education, health, and social welfare aimed at the holistic development of the Filipino street child in Metro Manila. Okay. We trace our roots back in 1986 when Childhope International was established in Guatemala by several international agencies who saw the need to address the worsening situation of street children in the world. In 1989, the Asia office was opened to facilitate collaboration in the Asian region with its headquarters in Manila, Philippines. When Childhope International closed down, the Asia office continued its operations as it saw the need to address the plight of street children in the Asian countries. In 1995, Childhope Asia office officially became Childhope Asia Philippines, registered as a local NGO under the Securities and Exchange Commission. In 2013, we changed our name to Childhope Philippines with its programs focusing more on Filipino street children. And in 2015, Childhope Philippines became Childhope Philippines Foundation, Inc., upon the government directive that charities and nonprofits should bear the word foundation in its registered name. Okay. So our clientele are street children. A street child, by definition, popularized by UNICEF in 1993, is a boy or girl who is less than 18 years old, wherein the streets has become his source of livelihood or habitual abode, and that there are no responsible adults to protect, guide, and direct them. Actually, some experts say that if you spend more than 4 hours on the streets regularly, unsupervised by any adult, then you have experienced becoming a street child yourself. In the Philippines, we actually have three categories of street children. The first category, children on the streets. The second one are the children of the streets. And the third are the completely neglected and abandoned street children. The children on the streets, or the community-based street children, comprise about 70% of the total street children population in Metro Manila. A lot of them still have connections to a community. They attend formal school, almost all of them, but they spend a lot of time on the streets because their guardians, parents, or relatives work on the streets. After the day's work, they go back to the community where they have a dwelling, some place to stay, and so they stay there, and they get off the streets for that moment. For the second category, the children of the streets, or the children of street families, these are the ones that you see along sidewalks, living in abandoned buildings or in vacant lots. Okay? A lot of them still have also relatives or guardians who live with them on the streets. And a big chunk of this population, this category, also is still attending formal schooling. Okay? They comprise about 25% of the total street children population in Metro Manila. The last category, which Childhope gives the most priority with, are the completely neglected and abandoned street children. So these comprise about 5% of the total street children population. They do not have any supervision of an adult, and instead they are the ones who are commonly forming what we call gangs. But this actually based on our own experience. These gangs are being formed by these groups of children, not because they wanted to do something against the law, but it is actually for mutual protection against the harsh environment or the abuses that they might be encountering while they stay on the streets. And they are also the ones who are most prone to abuse, especially by adults around. Okay. Um, I will be mainly talking about Childhope's experience on how we address the digital divide in the context of answering to the needs of our street children beneficiaries, okay, in different areas like education, health, social welfare, and the likes. So it was the year 2020. What we thought to be another normal year greeted the entire nation with a literal bang. A volcanic eruption that displaced several thousands and left an aftermath of destruction and despair. With one of our staff severely affected by Taal volcano's wrath, Childhope Philippines geared up to reach out and bring our expertise in psychosocial support to conduct the briefing sessions with displaced children and families in an area in Cavite. And then there was COVID-19. While struggling to respond to the needs of the victims of the previous catastrophe, little did we know that what started as a single case of the virus infection will become a huge wave of illness sweeping the world over. The Philippines had its first case of COVID-19 on January 30, and its first documented local transmission on March 7, after which the infection has steadily spread to almost all parts of the country. Soon after, a public health emergency was declared, placing Metro Manila under community quarantine in what would become one of the world's longest lockdowns. All forms of public transportation stopped. Schools as well as public and private offices and establishments closed down, except for those providing necessary services. The barangays, municipalities, and cities have enforced their own lockdowns, and everyone except for the healthcare frontline workers are forced to stay inside their homes. Amidst all the efforts to stop the spread of the virus, the vulnerable sectors of the society, especially the poor and underprivileged, have suffered greatly as income sources, if any at all, were curtailed. They were forced to rely on relief goods from the government and some private organizations. Living a hand-to-mouth existence before the pandemic, they have no money or savings for food, much less medical expenses. Worst of all, they have little or no means of avoiding and preventing the spread of the infection. This already dire situation of street children in urban areas was exacerbated by the effects on education brought about by this COVID-19 pandemic. Although the National Department of Education, along with the DSWD, has been trying to make ways to beat the odds, the digital divide becomes even more glaring. While those in the upper margins of society have access to technologies that aid in better learning, like the internet, mobile gadgets, laptop, or desktop computers, there are these children in the outskirts of society that have limited to no access to these at all. With the new normal in education gearing towards online learning, the right to education of these vulnerable groups need to be highlighted and put at the forefront. Moreover, as we shift towards new education practices, they are bound to encounter greater challenges, not only intellectually but also in emotional and mental aspects. That is why it is very important to provide psychosocial support for them through constant motivation and counseling. In addition, health is of primary importance, and good health is one of the keys to be able to pursue learning, especially amidst the health crisis we were all experiencing. Actually, Childhope was not spared of the wrath caused by the pandemic. The organization temporarily suspended operations starting March 15, 2020. Its banner program, the Street Education and Protection Program, is anchored mainly on face-to-face, physical, direct interactions with street children, their families, and communities. Our alternative education sessions, counseling sessions, skills development activities, and even health and medical services were put on hold as movement restrictions were imposed. But that was not for long. Even as the direct services halted, we were keenly observing and following the situation on the streets. We noted a surge of messages on our social media page informing us of the status of our beneficiaries, their needs, and fears. Three primary concerns from among our beneficiaries arose. One, it's food security. since they were dependent on earning a living through activities on the streets. The second are health concerns, as they know very little or even nothing about the deadly illness. And the third is fear and anxiety over what will happen to them, their education, their interactions with families, friends, and their communities. So with a firm resolve, Childhope Philippines heeded the call of the street children. We are needed more than ever. And so only after 5 days of suspension of operations, we return to the front lines responding to the most pressing needs of our beneficiaries. The hashtag Delivering Hope Project, or DHP, was at the forefront of our COVID-19 response. DHP aims to conduct relief efforts, augmenting the need for food as well as hygiene and sanitation needs, which are important for the deterrence or prevention of the spread of the dreaded illness. We reach out to the public for donations, flooding our social media accounts with information on the situation at the community level, along with a call to action to provide much needed help to the street children, the youth, and their families. Our aim then was to reach 500 children and youth who are part of the STEP program, prioritizing those who are members of street families who have nowhere else to go for shelter or get food supplies from the local government. With much public support, we were able to help more than 1,400 families on a regular basis for more than 8 months, including partner barangays, other NGOs, as well as former youth beneficiaries whom we have already helped to find employment before, but found themselves jobless and unable to support themselves or their families due to the loss of income generating opportunities. 2 months into the community quarantine, the idea of shifting to online alternative education sessions was then put into light. To find out if this is feasible, an informal survey among the beneficiaries was conducted. It is aimed at gathering data on access to smartphones that can make use of online platforms like Zoom, Google Meet, MS Teams, Facebook Messenger, and YouTube. Significant results of the survey were as follows. About 60% or 300 of our street children and youth beneficiaries listed in our database have access to mobile smartphones. The said smartphones are either owned by a family member, owned by a close relative who lives nearby, or owned by the children and the youth themselves. The main concern about online access, aside from the availability of the gadget to be used, is the mobile load credits, which need to be purchased from resellers or prepaid load stations. Using these data that we gathered, the next step was to create a plan on how the target participants will be able to utilize these platforms through these gadgets. Our street educators were tasked to talk online with the children's parents, guardians, or relatives who own the smartphones and ask for their permission to let them use these phones at specific schedules within the week. After arranging the schedules for the sessions, our street educators created videos for use in conducting online alternative education sessions. Equipment was provided for their use, including pocket Wi-Fi subscriptions. Childhope's official YouTube channel became the central repository of lecture videos made by our staff and volunteers. Contracted prepaid load suppliers send load credits to the registered phone numbers of the participants for them to watch the video with the group and participate in the discussions facilitated by the street educator online in real time. As the lockdown progresses through 2020, we also received reports from the ground that a lot of our beneficiaries were experiencing fear and anxiety, issues that may greatly affect mental health. As such, our social workers have been on board since we resumed operations, providing much needed counseling among children, youth, and their families. Counseling sessions were also done online, with us providing mobile load credits for both beneficiaries and social workers. When the movement restrictions were slightly relaxed, our social workers were prepped to go back to the communities to do face-to-face counseling as deemed necessary. Childhope made all the necessary precautions, such as providing personal protective equipment like face masks and face shields to our staff, as well as provision of hygiene kits containing disinfectants, soap, and supplements to strengthen the immune system. In order to properly address the client's needs as well as the staff's, a mental health awareness webinar was also conducted. Another project that was put at the forefront was our health and medical services through the mobile health clinic, or what we call the 𝗔𝗱𝘃cie. Since prohibitions against children and youth below 18 years were still in effect, the 𝗔𝗃𝘃cie shifted to providing medical consultations and checkups through telemedicine, which is another milestone innovation for the organization. After these teleconsultations, the medicines were prepared by staff and distributed to the patients within the day. Those needing further laboratory tests were accompanied by the social workers to the nearest referral facilities, while those needing further treatment were referred to partner hospitals or health institutions. Through these efforts, no disabilities nor deaths due to delayed medical treatment were reported during these times. Our 𝗔𝗃𝘃cie team immediately went back to doing face-to-face medical consultations once restrictions were also relaxed. The staff were provided with level 3 PPEs, and the clinic van itself was fitted with protective barriers and sanitation equipment that were recommended for use by our local health experts. Among the most devastating effects of COVID-19 was its impact on the income-generating activities of the poor. Many of the youth and adult family members of our street children lost their jobs or means of earning a living, most of which were associated with their everyday connections to the streets. Those who have regular employment were retrenched due to the closure of several businesses that were not allowed to operate during the lockdowns, which lasted for 8 months in 2020. To provide alternative sources of income, we conducted livelihood training seminars among street-connected youth and adult family members. These trainings were conducted face-to-face in the open grounds of our headquarters to ensure that proper health protocols were strictly followed. A small capital was also made available for the graduates to be used for starting their own business or augment existing small business ventures of the participants. Utilizing our social media page and reach, we helped in selling their products online through virtual livelihood fairs. With school opening in October, Childhope Philippines acted upon the need for better access to technology and other learning materials through launching the new 𝗃𝗃𝘃cie Eskwela Mobile Community Learning Hub. Our old mobile education vans were redesigned and equipped with free Wi-Fi, mobile tablets, laptop computers, and printers, which the children can borrow and use for online learning to accomplish the tasks their teachers assigned to them. It also carries reference books, as well as school supplies that the children can get for free. Our street educators also served as guides or tutors to help the children out in doing their school tasks. As a direct result, the school dropout rate among our beneficiaries for school year 2020 to 2021 was only 12 out of the 259 enrollees, or only about 4.6%, despite the drastic effects of the pandemic on education. We are also very happy to share with you that through the 𝗃𝗃𝘃cie Eskwela, the combined efforts of our staff from all the different projects, our organization partners, and the perseverance of children themselves, the enrollment rate among our beneficiaries was up by 43.6% for school year 2021 to 2022. For the 32 years that Childhope Philippines is helping rebuild the lives of our street children and youth beneficiaries, we have learned several important lessons about serving the underserved, most especially during these most challenging times. First, access to technology doesn't only mean providing the infrastructure or equipment. Human resources are equally, if not more, important. Our street educators, our volunteers, they are huge factors in attaining our goals. There's no shortage of people who want to help. We just need to give them the opportunity and the platform to do so. Second, emotions fuel passion and make it a life mission. So don't be afraid to feel, to be affected, and to be empathic. It's what drives us to take action. Third, partnership is key to sustainable social development. Individuals, groups, organizations, every little step helps form a big leap. There is no small contribution when it comes to service for the marginalized. Fourth, always challenge the status quo. Never be complacent as the needs of the people change over time. You need to innovate and be dynamic. Last but definitely not the least, involve your beneficiaries all throughout the process of helping them. It is through this that they get a sense of importance and of ownership. Remember that they are the most important stakeholders that you need to gain support from. Make them partners in uplifting not just their own lives, but that of the community and the nation itself. The challenges we encountered over the years, most especially during this crisis, only made us stronger and more committed to fulfill our mission. Though we anticipate more challenges ahead, Childhope will continue to reassess our response, innovate our strategies, and adapt to the call of the times for the benefit of the vulnerable street children in the hopes of giving them a fair chance for a better future ahead. Thank you and good afternoon.
Wow, that was amazing, wasn't it? Let's give it up again for Dr. Harvey Carpio. Show him some love again in the chat, guys. Grabe, Ju. Grabe. Thank you so much for those wonderful insights. I was really able to learn a lot about, yung history nga and advocacy of Childhope, but more importantly, the quality of life that were being experienced by the street children. And you mentioned that there are three problems that they are mainly facing, which are the food security, health, and fear and anxiety. And hopefully, all of these participants, you guys, were able to become more aware of these issues so that we can be more involved in helping these organizations bridge the digital divide in our society. So, as sabi nga ni Dr. Harvey, let's allow our emotions to fuel this mission of helping the children in our society today.
Yes, I could not agree more with you, Migs. Honestly, I think my biggest takeaway is that we can't just provide them with the equipment, but it's also about that uh, emotional therapy and emotional help, because emotions, as Dr. Harvey said, will fuel that passion and will fuel them and motivate them to actually study and help, further their education better. So I really enjoyed listening to all the solutions that Childhope has been doing and all the efforts that they've been doing during this pandemic to help the street children who need education the most during these trying times.
Indeed, you are right. And we'd like to thank you again for that wonderful talk. But now we have to move on to our next agenda. So, of course, we would like to give our audience some time for your questions. So, kindly send in your questions through our Slido number, #800, or our link, which will be sent down in the chat below. So, you can also comment your questions in the chat box. And, of course, we will try our best to entertain them.
Ayun. So I looked
Yes.
at the Slido link and I think we have a lot of questions coming in right now. So we can start with our first question, which is given the opening of face-to-face classes, how will this affect the situation of the students at the moment? What adjustments will have to be made?
Actually, yeah, thank you for that question. No? Um, it should have been uh, well planned. I mean, I agree with limited face-to-face classes. However, these should be like what VP Lenny said, in those that are low-risk areas. Okay. In the news, I've heard a school who has initially been planned to go. Who had initially started a limited face-to-face classes. However, they had to shut down their their operations because the teachers came out positive for COVID-19. That's how unpredictable actually the spread of the virus is, especially with the different variants that are coming about. But I think it could be done as long as it is well planned. But being a doctor myself, when I heard of the news that they will be doing this already, the face to face, I was really worried because um, frankly speaking, we haven't been able to really address the pandemic quite sufficiently. So, but right now, with the vaccination of the vaccination drive, rolling out the vaccines for much younger population, I think there is a light at the end of the tunnel for face-to-face education. And for Childhope, actually, we actually are preparing for the same scenario already. Because even before, when we were during the pre-pandemic times, we've been conducting face-to-face classes with our children. So as long as we were observing proper health protocols, the PPEs are being worn by both the teachers and the students. I think there wouldn't be any cause for concern with regards to face-to-face classes, but only on a limited capacity.
Yes. Thank you so much, Dr. Harvey. I definitely agree that I'm glad to hear that Childhope is actually making that effort and already planning out what's going to happen when we start going back face to face. But it definitely, the priority is still making sure that everyone's safe, every child is safe out there, and making sure that we're all healthy and that we also don't get COVID. So thank you so much for that. Maybe Migs, you can ask the next question.
Yes. So far, for our next question, it is how can we as the youth contribute to the advocacy of bridging the digital divide?
Actually, just merely talking about the issue and sharing it on social media, which where this generation is really very active, it brings the issue at the forefront already, and it makes it relevant. So our political leaders can listen and take on the opinions of the issues that we share, and make it a part of their agenda. The agenda in education, especially pushing education forward in this era. So I think that is one of the most important contributions that this generation can do without really having to spend so much. And of course, volunteerism is highly encouraged. There are a lot of things to do, and NGOs like us cannot do that alone. We need the help of volunteers like you out there. Like what I've said, there are I know a lot of young people who wanted to volunteer. We just needed to give them the platform to do the volunteerism.
Yes. Thank you so much for that, Dr. Harvey. It's super glad to hear that actually our youth today is actually contributing in their own little ways through sharing posts and all that. And hopefully people become more aware of the power that we have as the youth, even in sharing posts and all that. So Ju, I think you can move on to the next question.
Okay, for our third question naman, someone wanted to ask, what's the most difficult part about continuing to serve at this time?
Continuing to serve.
Continuing to serve at this time, yes.
Okay. Sometimes, it dawns on you that it is a really hard work, and you can ask all of all of my colleagues at the NGO world. NGO work is multiple times harder than regular work. Because you are working to change the social phenomenon. Okay, so it sometimes like the phenomenon of street children, it's deeply rooted in our society. So that's what we're working to change: the ideas, the concepts, even the social stigma that is associated with being a street child or a street dweller. So sometimes it gets disheartening, but we find strength and inspiration in other people also who are kindred spirits and working on the same field. We find inspiration in people who support our work and are vocal in supporting it. and we find inspiration. Like me, I have a family. I have a daughter. We find inspiration in our own children, because we wanted to work for a better future for them also, and we want that future to be inclusive. So that's how it is.
That's so nice to hear. Thank you so much, Doctor. It's so great to hear that even though that it may be difficult at times, that you really have the passion to really, you know, serve this mission and serve the street children and give them accessible education. As you said, you get inspired by the people who support the advocacy, and hopefully that anyone here in this call, even if they just learned about the advocacy today or knew about it from before, would get inspired by your talk and by our different activities this week for CSR to actually make a change in Philippine society. So thank you so much, Doctor.
Actually, if post pandemic, we invite everyone if they wanted to reach out or get involved in any of our activities, doing the actual experience of volunteering and interacting with the children is a life changing thing, life changing event. And we also encourage that because that is how our children beneficiaries develop their confidence, and that's how they get to be inspired also to work harder for a better future, because outside of our team, they know that there is someone else out there that is caring for what they are doing or what their future would be. So that is a big plus factor.
Yes. So narinig niyo yun, guys. If we are allowed to go back face to face and it's safe, you can definitely help out with Childhope Philippines to help bridge the digital divide. Ayun. How about the next question, Migs?
Yes. So the next question po is, was there a certain experience that made you want to do what you do now?
Yeah, actually, it was way back in when I was in medical school, early years of medical school. I don't know if there are med students attending here, but it was the story of the child Rosario, and it was a story about a child who is malnourished, suffering from diarrhea, several problems in the families, etc. So she was brought to the health center to be checked up by the doctor and was given medicines, but was sent back to the community, and then it worsened and Rosario died. So it was the takeaway there is you health is not just or working for social development is not just answering what is there in front of you, but it's also having to consider all of the contributing factors that has led to that particular person's current dilemma. Okay, so my takeaway from that lesson in med school is that what good does it do to treat people's illnesses only to send them back to the conditions that made them sick? So that's how social development is. We work towards the upliftment of the status of the welfare of our beneficiaries by doing our programs holistically, simultaneously targeting all of the aspects for development of a child, because one aspect should not be forgotten, so that they grow to become respected and responsible members of society.
That's super great to hear po. It's super inspiring to see how you have this story that fuels your passion into helping the children talaga to lift themselves back up. And I hope everyone also in this call has their own story that can, fuel their own passion as well into helping bridge the digital divide. So thank you so much for that beautiful question and for a beautiful answer also. So Miss Juhil, would you like to move on to the next?
Yes, so this will actually be the last question. But as you said, Migs, maybe they have their own experience or story that will begin their journey in bridging the digital divide. So maybe this is the start, because I wanted to ask you, Dr. Harvey, what is one piece of practical advice you would give to someone who wants to go towards the same path you took?
um, I think if you are a religious person, or like not religious actually, I always that pray to God during my prayers, my communication with Him. Lead me to where you want me to be. So that is actually a very dangerous prayer, if I may share, because it may lead you to a lot of difficulties, but it also leads you to a way that is most fulfilling in life. And the second one, that's the first. I have two actually. The second one is find a partner that understands your work. uh, my wife actually is also a doctor, a classmate of mine, and she understands and shares my passion and my mission. So that is we find support in each other, and I think that is a sound advice also for all of you guys out there.
Ayun. Thank you so much, Dr. Harvey. I bet that was very practical and useful for the person who asked it. And I hope anyone who listened got inspired and actually took notes on what they can do so that they can also take the same path as Dr. Harvey did.
Yes, but unfortunately, guys, that is all the time we have for Q&A. So again, thank you so much to you, Dr. Harvey, for your amazing and insights and of course to everyone who sent their questions in.
Yes. Again, thank you to our esteemed speaker, Dr. Harvey Carpio, for providing us with so much knowledge and insights on the digital divide in Philippine education.